Fox 4's Calvert Collins joining us now from Presbyterian Hospital with the latest on what's happening inside and outside isolation. Calvert.
Well, Heather, 26-year-old Nina Pham is stable, as you mentioned, listed in good condition, and she's not the only person in isolation. A close contact of hers is also there. He works for Alcon in Fort Worth, but is not showing any symptoms of Ebola. Now, the CDC has added personnel and also admitted early faults in its procedures.
It's just so nice to see how concerned they are, and it's like one of their brethren, I think, involved.
Nina Pham is a popular patient. Officials say there's no shortage of nurses wanting to treat her, but the CDC is minimizing her care team without revealing specifics.
We want to limit the amount of people who are exposed to it, so maybe instead of 50 people going in and out or handling specimens, if we can cut that down to 40 or 20, it's less people exposed, less people put in jeopardy.
2 nurses from Emory Hospital in Atlanta with experience treating Ebola patients flew in last night. But Pham's primary caregivers will be Presbyterian staff.
So now the hospital is set.
County Judge Clay Jenkins declared the massive hospital as the official Ebola ward for North Texas. So if anyone, including healthcare workers, show symptoms, they need to go there.
We have not yet identified a specific interaction that resulted in the exposure and infection of the nurse.
Despite her cooperation, Nina Pham's point of Ebola exposure remains a mystery.
They suspect taking the equipment off. They suspect intubation procedure or dialysis, and I don't think we have that smoking gun yet or know exactly what caused it.
The Liberian man she treated extensively, Thomas Eric Duncan, died October 8th. But his 48 friends and family have crossed an important threshold. They are now 2/3 of the way through the 21-day Ebola incubation period.
But as you move further and further away, the number or the odds drop way down. So not saying it won't happen, but based on the data, it would be surprising.
Nina Pham's 75 colleagues are now under the microscope, being checked every day until October 31st for symptoms. The director of the CDC says in hindsight, the agency could have done more and should have sent a larger team sooner, and will now urge ERs nationwide to ask pertinent questions first.
Whatever is done with where care is provided, every hospital in the country needs to be ready to diagnose Ebola. That means that every doctor, every nurse, every staff person in an emergency department who cares for someone with fever or other signs of infection needs to ask, where have you been in the past month? Where have you been in the past 21 days? Have you been to Liberia, Sierra Leone, or Guinea?
The CDC has now established an Ebola readiness response team that will be on the ground in any city where a positive Ebola test is confirmed. And here at Presbyterian, there's now a site manager who will be monitoring infection control as well as the protective gear, making sure that it is put on and taken off with all caution. And the CDC is also adding training not only here at Presbyterian, but also webinars and classes for hospital staffs all around the country. Heather?
All right, Calvert Collins live tonight. Thank you.